democratizing this life-changing procedure for as many people as we possibly can, because I think sometimes in the day-to-day you kind of forget about exactly how life-changing this actually can be for a lot of people, and how big of a decision it is for a lot of people, and how many choices there are, and it's just hard to kind of learn about it. And our goal is to really just make this as simple as possible. We have the best doctors, we have the best offices, you're going to be taken care of the best here. Our price point is the best. Everything about this decision is something that you'll feel proud of. Yeah, I think for us it always comes back to the word impact. So when we were dentists in our own kind of journeys, in our own practices, we always felt like there was something bigger out there for us, and we feel like, sometimes as dentists you don't really do all the life-changing procedures and stuff as a general dentist, and we thought, man, there's a way to really help out a lot more people. So we figured this is a great way to do that. I think it's most important for our patients to know just how amazing our doctors are. When you're trying to look for this procedure other places, it's hard to know exactly if the doctor is good. You can read Google reviews and things like that, but you don't exactly know. I think as Shared Practices Group, this is probably our strongest suit, is our doctor community. They're excellent clinicians. They really, really care. They hold each other accountable. They share wins with each other in the chat. They ask questions to each other. I mean, it's a national group of really, really excellent doctors. And I think a rising tide really lifts all boats as it relates to our doctor community. It's a career I wish I would have had when I graduated dental school, to be totally honest. It's a way to use your degree in a way that you probably didn't think about when you first went into dental school. It's something you can really focus on one or two procedures and get excellent at them and do some really high value work for the people in your community. I think the lifestyle at our practices is excellent. It's not, I was in practices where I was running around like crazy, seeing 40, 50 patients in a day. This is much more boutique style. You get to take your time with patients. You really get to actually get your hands, into the procedure and really kind of touch all parts of the procedure, which is something that, as a busy office, it's really, really hard to do. So I think it's a really good lifestyle. You make really good money. You help a lot of people. I think it's the best. Yeah, I think our culture is a culture of internal accountability. So I think even at the founder level, we hold each other accountable. We make sure that, we are all focusing on the right things, so we're all rowing in the correct direction. And I think that trickles down to our central team, and especially to our doctors. They really hold each other accountable. They help each other out. They travel all over the place with each other and make sure that people have all of the education that they need, all of the tools in their tool belt that they need to actually perform this procedure. So it really is, we're all in this together. The whole point of a platform is to give people a place to kind of grow together and get better together and not be on an island somewhere. It's scary sometimes when you're practicing dentistry and you don't exactly know where to go, who to ask. If something happens to go wrong, you're not exactly sure how to fix it. And in our group, we have 5-10 doctors at the ready to answer the phone and say, hey, here's the next step. Is it going to be okay? Here's what you do. That's a great question. If you had asked me 5 years ago, I probably wouldn't have said that we've had the room that we have downstairs, 150 people. I really feel as though the sky is the limit for this group. I feel like we're just kind of scratching the surface of what we can do. I feel as though there's so many more doctor opportunities. There's so many more patients that could use this procedure. There's still a lot of islands within the United States where there's no one doing this, right? And that's one of my big takeaways. I'm from a rural community. I understand that, and I understand when I look at our map of where our patients come from, there's big blotches in certain areas where there's no one, and there's no one providing the procedure. So that's one of my big missions in this company is to kind of, again, democratize this procedure to everyone who needs it, regardless if you live next to a big city or if you're a little more rural. I want to make sure everyone that truly wants and needs this procedure can actually get it. I think it's people that just have buy-in. I think it's if someone really applies themselves to this company, to their role within this company, they can go as far as they want, whether you're a doctor, whether you're someone in the office level. We've had plenty of people at office level that have elevated themselves into central team or traveling roles or whatever it is that they want to do. We have doctors that started young with us right out of residency programs, and then now they're traveling around teaching this procedure to all their peers, and they're doing CE courses, and they're the key expert opinion leaders on all of these things, and they're writing articles. I just think that's really, really cool that that kind of all happened under our roof at SPG. So I think You can go as far as you want to go with an SPG in any role. Yeah, this is big. I think, again, it goes back to the continuity of care with the excellent doctor at your location. They will be the ones treatment planning your case. They'll be the ones talking with you before we start the case. They'll be there for your surgery and performing your surgery. They'll be there for the post-operative steps along the way. They'll be there to restore your case. And most importantly, they'll be there for post-op care after the restoration's in place. And I think that part is a lot. There's parts of this chain that if someone else is doing, it's really hard to it's the same doctor kind of needs to be doing that the entire way through. So I feel as though, choosing this procedure, it's hard to know as a patient facing. There's so many variables. It's hard to pick, this doctor, they look nice on the website, but how do I actually know? I think at SPG, our level of vetting that we have for our doctors, our rigorous training programs and our rigorous admissions program into our doctor ranks is proof enough that these doctors can do this procedure and can do this procedure very, very well. And that's something that I feel like we're uniquely qualified for at SPG, is to pick the best doctors, put them in the best places to succeed and create life-changing results. So our doctors are excellent, not only clinically, but with patients as well. They truly actually care about, the procedure, how it goes. To me, I think one doctor doing the procedure from start to finish is paramount. So if you have one doctor that sees your procedure all the way through from beginning to end, they can they're in charge of all the steps, and they understand that the steps at the beginning really impact the steps at the end. So they're very, very in touch with each individual step along the way. Versus if you go to two different doctors, someone could do one part of the procedure, someone could do another part of the procedure. Sometimes the blame, they're pointing their fingers back and forth at each other, and it's hard to, as a patient, you don't necessarily really care who's at fault, you just want it fixed, right? At our offices, the doctor's in charge, the doctor has done all the steps of the procedure, and the doctor knows exactly what to do in any situation there, because they planned the procedure themselves, they did the procedure themselves, they're restoring the procedure themselves. I think that's huge. I think that's something that it's hard as a patient to know the benefits of that, but I think that's probably the biggest reason why I think SPG is the best place for someone to go to.